So today we're going to start another important topic, which is actually vasovagal syncope of fainting. So let's start it. Bismillahirrahmanirrahim. So basically, the cause is actually transient hypotension and cerebral ischemia. The patient has the predisposing factors like anxiety, pain, injections, fatigue, and hunger. How can we learn this actually? The mnemonic for this is actually all patients in fear of heart. A for anxiety, P for patient, I for in, fear means fatigue, H for heart. And the signs are basically dizziness, weakness, and nausea, sweating, pallor, cold, moist skin, initially slow and weak pulse, which actually becomes full and bounding, loss of consciousness, minor convulsions, or incontinence can occur. And for this you can learn, don't worry, some people can suddenly feel like collapsing instantly. D for dizziness, W for weakness, S for sweating, P for paler skin, C for cold moist skin, F and basically for S it is slow and weak pulse initially, and later it is full and bounding pulse, loss of consciousness, and convulsions and incontinence. So the pathophysiology for this is actually the patient when suffering from stress. We know it. In stress, we know our sympathetic nervous system is activated. So what catecholamines are released? Epinephrine and non-epinephrine is released. There's a decrease in the peripheral vascular resistance. The peripheral vascular resistance become decreased, and there is actually increased blood flow to the periphery muscles. Okay. Now, basically, the venous return becomes decrease. So basically, there's a mistake actually. Normally, when we feel stress, so catecholamines are released, means sympathetic nervous system is activated. But in this, what happens? There is actually a paradoxical uh, activation occurs. Instead of activating sympathetic, it activates the parasympathetic system actually. And basically what happens, there is a reflex is involved, which is known as basalt cherish reflex. There's a decrease in peripheral vascular resistance and increased blood flow to the periphery muscles. Okay, in your periphery there is actually pooling of blood, and the venous return becomes decrease to the heart. There's actually also decrease in circulatory blood volume and drop in arterial blood pressure. Okay, then activation of compensatory mechanism, the reflex vaguely mediated. Basically we have here decrease uh, heart rate, which means we have actually here is bradycardia. Significant drop in cardiac output is associated with in the fall of blood pressure, which is below the critical level. The patient undergoes cerebral ischemia and loss of consciousness. Now how you manage in prodrome condition, when you think that it's gonna happen, so you will stop the procedure. Place the patient in the supine position, legs rise above the level of head. Lay the pregnant woman or patient on her side, and place the cool towel on the patient's forehead. Syncopial episode, if occur, terminate all the treatment. Place the position in supine posture with the legs raised above the level of head and check for breathing. Patient is if the patient is not breathing, to start the basic life support, have someone medical assistance, and consider other causes for syncope. If present, crush the ammonia ampoule under the nose and administer the oxygen. Monitor the vital signs. Have patients escorted home. Plan anxiety control measures during the future dental care. For regular fainters, use anxiolytics like temazepam 5 mg orally on the night before and again an hour before the treatment.